So now we have a wonderful presentation called You Fixed My Heart, So Why is School So Hard? How the Herma Heart Institute is bringing innovation, follow-up care into the classroom. And since we had our joint session with CNOC last night, this just fits right along perfectly with that. Kyle Landry of the Herma Heart Institute is going to be presenting.
Hi, I'm Kyle Landry, and I'm the School Intervention Program Manager at the Herma Heart Institute at Children's Wisconsin. I am very excited and thankful for this opportunity to be part of today's CHD Innovations Shark Tank. Have you noticed that school is just harder for your heart warrior? As a parent, you do your best to communicate with school staff and advocate for your child's unique learning needs, but often feel dismissed as if you're being too pushy, overreacting, or babying them? Have you been told that he's just lazy? Have you heard that all children learn at different paces and she will catch up on her own? Well, I'm here to tell you that you're not alone and share how the Herma Heart Institute at Children's Wisconsin is bringing innovative follow-up care beyond the walls of the hospital and into the classroom. Congenital heart disease is the most common birth defect worldwide, affecting 1 in 100 live births and over 40,000 children born annually in the United States alone. Thanks to significant medical advancements and outpatient treatment options over the past few decades, this challenge was uncovered. Subtle neurodevelopmental delays in multiple domains were more commonly observed in children with a history of congenital heart disease than their typically developing peers. As cardiac neurodevelopmental follow-up became more common, hospital teams identified that delays may arise at different stages from birth through adulthood as organization, independence, and skill level demands increase. These deficits generally do not self-correct, and academic difficulties may increase over time as these children simply don't catch up on their own. The same research studies also revealed that hospital teams recommended schools provide individualized educational services and supports more than 3 times more often than they actually did. Without medical training specific to a child's particular illness, school staff may mismanage medical symptoms, underestimate health limitations, and overlook related educational deficits. Risk of school complication is especially great in the many schools that do not have full-time on-site nurses. A recent study conducted by the School Intervention Program revealed that only about 1/3 of school staff, and that's including school nurses, recognize and understand the heart-brain-body connection. Without awareness of the link between a child's medical history and the academic problems observed in the classroom, school staff often inadvertently discriminate against children with chronic illness by assuming poor performance is linked to poor effort and overlooking opportunities for that really critical early intervention and educational support. Realizing this gap in patient care, the Herma Heart Institute launched the School Intervention Program with an overall mission to identify health and academic problems in a clinical environment and conduct interventions in a school setting, improve long-term cardiovascular, neurodevelopmental, and academic outcomes by increasing school staff knowledge about the heart-brain-body connection, expand school health and educational service that meet patients' comprehensive needs, and establish enduring partnerships with schools to collaboratively address new health and learning challenges as they arise and change over time. The School Intervention Program's unique coordinated care system places experienced educators specifically trained in cardiac diagnoses and related neurodevelopmental impacts of surgery, treatment, and complications at the center, serving as an information hub to ensure clear and consistent communication among families, schools, medical teams, and community partners, such as private therapists or after-school tutors. The Herma Heart Institute offers the school liaison service to all school-age patients followed for cardiac care. These interventions aren't meant to be quick fixes, but rather intended to create those enduring partnerships with school teams by taking the following steps. During months 1 to 2, the school intervention team conducts a comprehensive assessment which includes collecting and reviewing related medical and school records, such as attendance records, recent report cards, or progress reports, and any health or educational plans that are currently in place. Next, the team obtains input from key stakeholders who work with the child in various environments. This includes interviews with the patients, if they're over the age of 7, parents, teachers, school and/or district nurses, and private therapists. Once all assessment data is collected, a school intervention specialist reviews the information and analyzes how the child's medical background may be impacting their educational achievement. During months 3 to 4, the specialist creates an intervention plan, which typically includes a formal request for school-based educational evaluation or reevaluation if needed, individualized recommendations for academic services and accommodations, individualized recommendations for school health plans and emergency action plans, and leads an in-person presentation where the specialist explains the child's medical history in layman's terms, describes the connections to the developmental deficits observed in the classroom, advocates for educational plan qualification, and recommends school health and learning supports. Finally, in months 5 and 6, outcomes data is collected by sending a set of follow-up surveys to the original pre-intervention respondents. If school challenges have been steadily improving or have resolved completely at that time, the child moves out of an active intervention and into an annual check-in. Yes, the school intervention program follows children across their entire educational career, from preschool through college. And we're there to advocate for your child through those changes that come with new teachers, new schools, and/or new medical needs. Best of all, these services are offered free of charge. It's a standard component of the Herma Heart Institute's follow-up care. In 2017, of patients enrolling in the school intervention program, 21% came to us with individualized educational plans already in place, with a whopping 74% of patients who experienced significant school challenges remaining largely underserved by their schools. Following school intervention services, 97% of those children had new or improved individualized education plans in place. While this data clearly shows the need for hospital-based school intervention services, it also illustrates how school intervention effectively fills that gap in care coordination. One might argue, yes, this is great, but advocating for educational plans are not traditionally within the clinical scope of practice. And you'd be right. However, patients' health and safety at school definitely is. Patients who have received school intervention services experience 2 to 4 fewer hospital system visits per year post-intervention compared to their utilization rates pre-intervention. This includes fewer emergency room trips, fewer inpatient stays, and fewer outpatient clinic visits. You might wonder, how is this possible? Well, children spend the majority of their waking hours at school. When school staff are properly trained in cardiac health and symptom management, they are easily able to identify when something just seems off, a subtle change that could quickly turn into a much larger illness or infection if not caught early on. With reduced hospital visits comes reduced hospital charges. And I'm not talking about a few dollars here and there. Our preliminary data found between 44,000 to 78,000 fewer charges per patient per year compared to a control group of similar cardiac patients who had never received school intervention services. The Herma Heart Institute is known for our high level of cardiovascular care, but that is not enough. While we sing and dance and celebrate each time our patients walk off the unit with their families, we don't rest. We know our work is not done. The school intervention program is just one really awesome example of how we keep raising the bar of innovation and encouraging our partner institutions to follow. Thank you.
So I want to especially thank Kyle for her patience, because it took us a little bit of time to get this wonderful video to you guys, but we did it, and she was very persistent. So thank you so much, Kyle, for that. Andrea, do you have any questions for Kyle?
Yeah, we do have a couple of questions, and Kyle, you can feel free to turn your video on if you'd like. And 2 questions. One is, how is it funded? And the second part of that is, have you been widely accepted into the school districts as a good resource? I know sometimes schools like to keep their IEPs within their own district. So those two questions.
Yep, absolutely. The how is you funded question is a big one. It's a challenge, right? We are funded currently by the Herma Heart Institute as part of their innovation dollars because they believe it's important. So it's kind of like social work. It's a part of follow-up care that they believe in and that they will pay for. Part of our issue with having this program expanded throughout the hospital to, the multiple specialties and service lines we have is because not every area is able to get that funding or to find that funding for this type of program. So it's really, really hard for especially smaller programs. In addition to that, we do have a ton of grateful families and just institutions outside of the hospital that support this work. So we do function with a lot of donor dollars, and we also get quite a bit of grant funding too. So we started kind of heavily funded by the HHI, and now as we get more popular within the community, I'm going to use that in quotes, we are getting more funding coming into us, but none of it is billable. And then the other question, how do schools accept us? They love us, which is not what I anticipated when we started this program. When we first started hiring, we started with educational experts solely because we wanted the schools to understand we're not a third party coming in. We're not the hospital coming in to tell them what to do. We're teachers also. We all have backgrounds in special education. We understand the IEP and 504 process. And that has been a really important part of getting schools to kind of accept us from the beginning. The other thing we take a lot of time to do is to tell schools we're not quizzing you. We're not trying to catch you doing something wrong. We want to understand where there are gaps and we want to help fill those gaps. And then we're not going to leave. We want to be a resource for the schools just as much as we are the parents. So we're there and they have our contact information and they can reach out to us directly anytime to help them work through some issues with particular students, but also, hey, I have another student. Obviously, we can't get into details about that other student without some of that HIPAA documentation and some of the authorization we need, but we can get general, try this, without using names or specific diagnoses. So we really try to make these enduring, I know I said that a bunch of times, but enduring partnerships with the schools, and that's been really, really well received.
Great. I'm looking to make sure that we don't have any other, oh, I do have another question. Can you provide a few of the top recommendations that are typically given to the schools?
Sure. The most important thing we do, and this isn't so much as a recommendation as it is help them connect that the child's medical history can be really traumatic and how that relates to maybe inattention in the classroom. And the number one thing I do is I use the analogy of telephone wires when I'm speaking to school staff. And I say, if you look at the brain of a child born with a congenital heart defect and a typically developing child, you see that there's fewer connectivity hubs and fewer connections between those hubs in the brain. And what I tell the school staff is if you think of phone service and telephone tower, cell phone towers, and if you go out in kind of a more remote area and there's fewer towers and less connections between those towers, everyone knows what happens. You're going to get some fuzzy calls, you're going to get dropped signals. And that's kind of what we're seeing in some of our children's brains. And that helps schools understand, understand that connection a little more, that, oh, maybe this isn't directly connected in the sense that we originally thought, but here's where some of those dropped calls come in. So that's my number one tip for helping schools understand. In terms of accommodations, we have a ton, but we do a lot of extra time on testing just for processing information, a quiet room if possible. A lot of our kids with IEPs and 504 plans, we like school staff to know what to look for in advance. So in those meetings, maybe we're not seeing some of the problems with executive functioning, let's say, at the moment, but here's what to watch for so they can implement some accommodations as soon as they're starting to see some of those subtle differences. So that's been really helpful also.
Great, thank you.
Kyle, thank you so much. And
You're welcome. Thank you.
the way you present in such an easy to understand manner, and the telephone pole line analogy was perfect. So thank you for that.
Absolutely.
Thank you to all of you at the Herma Heart Institute at Children's of Wisconsin. You guys are amazing as always, and we really appreciate you being here today.
Thank you.